Hi, I'm Dr. Bartolomescu, the medical futurist, and today I want to follow up on my previous video about when and how the COVID-19 pandemic will end. Back then, my prediction was that it could end in 3 different scenarios, and by now we know that the virus won't just miraculously go away. But while parts of Europe breathed a sigh of relief as their case numbers went down, other countries like the US or Brazil are breaking records each day. And by now there is one thing on everyone's mind. Is there going to be a second wave? More than a century ago, the second wave of the Spanish flu was deadlier than the first. But is it inevitable with COVID-19? Technically, to talk about a second wave, the first wave needs to end. And in order to say one wave has ended, the virus would have to be brought under control and cases have to fall substantially. In some parts of the world, we've seen that happening.
Reporting no new cases of the coronavirus for 17 consecutive days.
The problem is, for even the most successful countries, these were probably all temporary reliefs. A new study from King's College London inspired a swarm of headlines suggesting that immunity might vanish in months. They had tested close to 100 people with COVID-19 repeatedly for months. At first, the subject's blood was filled with antibodies. 2 months later, the antibodies had disappeared. The implication was clear. Individual immunity is temporary and herd immunity is off the table. Fortunately, this study is anything but definitive. First, the test was only looking at the antibody numbers and didn't account for T-cell response, which is not a comprehensive way of looking at immune efficiency. The study also doesn't mention that fading antibody response after several months is nothing unusual. Other vaccines that have an effect that lasts for decades work similarly. And also, we don't know what kind of immune response is needed to beat COVID-19. Low levels of antibodies might just do the trick, but still, the study is troubling, even though it's not as dire as it first seemed. So with herd immunity in jeopardy, let's take a look at the vaccine. Researchers around the world are developing more than 160 types of vaccines against the virus, and there are dozens of them that are already in human trials. There are now promising results from British, Chinese and Russian labs where early tests show that the first vaccines induced antibody and T-cell response as well. It remains to be seen, though, whether these vaccines are safe in the long term and whether they could protect people for an extended period of time. What's also unclear is how older people would react to it, since most of these tests were done on people between the age of 18 to 55 with no history of coronavirus infection. Developing a vaccine is usually taking years, if not decades of work, but there is an unprecedented race to get these ready by the first quarter of 2021. But don't expect to have access to them right away. First, these shots will go to the medical workers, immune deficient people and the elderly. So in conclusion, as for now, we are just as vulnerable as we were in the beginning of the pandemic. So, what can we expect next? Even where the virus has been brought under control and cases have fallen substantially, we've already seen COVID-19 slowly crawling back when regulations got loosened. For example, Israel's first wave of coronavirus was a success story, but only weeks after reopening the country, it is now seeing a 50-fold surge in new cases. They went from approximately 20 new cases a day to more than 1,000 in 2 months. The country is now forced to close down once again. We've seen similar trends in the US as well. The carelessness that stems from people taking a sigh of relief after months of lockdown by forgetting social distancing and the importance of wearing a mask leads to a strong second wave even in those countries that successfully managed the first wave. And there are countries like Brazil and the US where even the first wave is so mismanaged that it's not even defined whether we can ever talk about a second wave. It seems like they are on track of having just one gigantic and tragic wave that can claim 100,000 new cases each day in the US. Even though at one point about 90% of all US citizens were under some sort of lockdown order and the curve was successfully starting to flatten. But a few states started to loosen restrictions on their own, kickstarting whole new outbreaks that are now unstoppable around the country. But some good news. The drug called remdesivir seems to be a powerful weapon in the fight against the virus. For the already hospitalized COVID-19 patients, this drug could speed up the recovery and significantly lower the risk of death. If it gets through human trials, we will face a second wave with a treatment protocol that will make COVID-19 much less lethal and will be able to alleviate overburdened hospitals by cutting recovery time short by 47% according to some trials. Of course, unfortunately, the price of a remdesivir treatment is going to be twice for Americans, that is, if they have insurance at all, even though it was close to $100 million of American taxpayers' money that went into creating it in the first place. But that's another story. Back to what the second wave holds. The main question we all face is whether it will hit at the same time as the flu season. We've seen how the first wave pushed hospitals to the brink. Now imagine that during the fall and the winter, when with the seasonal flu coming around, we could have two circulating respiratory pathogens at the same time. Remember, the seasonal flu can be deadly as well. It kills around 40,000 people per year in the US alone. This is the reason why most public health experts anticipate a big uptick in the last quarter of the year. And because of overlapping symptoms such as fever and cough, it may be harder for individuals and doctors to immediately determine which infection you have. So, are we heading for another lockdown? By mid-July, about half of all US states were either reopening or had reopened. Meanwhile, the other half had either paused or begun rolling back reopening plans. Health experts stated that if you are able to effectively test for COVID-19 and follow up with contact tracing, while people practice social distancing and wear masks in public, it would be possible to maintain control over a second wave without going back to a full-blown lockdown. Unfortunately,
are you going to allow the government to tell you you have to wear a mask?
You could call it a mask mutiny.
Wearing a mask can actually cause you to get sick. So
wearing a mask can actually cause you to get sick.
Yes, absolutely.
In Serbia, as case numbers started to skyrocket and the government announced restrictive measures, protesters broke into the parliament, forcing the populist president to back down on reinstating lockdowns. In the US, the White House had begun formulating a new coronavirus communication strategy summed up as "we need to live with it." And the Trump administration already started to wipe out publicly available COVID-19 data the way they cleared every mention of climate change from the EPA's website when they took over control. Basically, we are now blind about the real case numbers in the US. This way, the only question for countries like these is how long can they hold on before another lockdown? By going against any restrictions, they are predestined for the harshest. But even then, the second wave will be slightly different. The R number for every virus is one of the most important factors. It tells us the number of people each infected person passes the virus to on an average. For COVID-19, that number was around 3 at the start of the pandemic, meaning it was spreading very fast. But in many ways, we have adapted. Most of us are wearing masks in public and we are social distancing. That number won't be that high the second time around. Even in countries where people are ignoring restrictions, are more self-conscious about washing hands and just generally to be safer. For this reason, the second wave will be relatively slower and hospitals will be more prepared to deal with the influx of patients. But without the discipline we showed in the beginning of the first wave, it could also potentially be a lot bigger. But when the second wave hits, we will at least have another tool in the fight against it: sewage water. During the first wave, researchers have realized that people start to shed the virus in feces up to 2 weeks before the onset of symptoms. So, samples from sewage water can be used to trace about how many people have been infected. And the same way, we can predict when these invisible clusters will peak. So ideally, we can be 2 weeks ahead of the curve, which, as you've seen in the beginning of the pandemic, can be the difference between an outbreak and a full-blown epidemic. So, if you want to plan ahead, expect a second wave and expect that the restrictions and the cautiousness are here to stay. We need to wear masks in closed spaces, with our noses within the mask, obviously. We need to practice social distancing and wash hands regularly. The travel restrictions will also probably be stricter and be prone to change in a week-to-week basis, as now different countries deviate in how successfully they are able to flatten the curve. Based on every public health expectation, there will be a second wave, but we can remain confident that we will be better prepared. So to follow up on my previous video, I would say we are living through the second scenario, and most likely the rest of this year will continue to be about our struggle with this virus until the vaccine becomes available, and then hopefully we can put all this behind our back. Stay safe out there.